Urine testing. This came up, I think, at the February hearing. How accurate is urine testing for measuring blood alcohol content?
It's not.
But that's what we're doing right now.
That's what the law, you have a per se law that gives concentrations in urine and, I guess, punishments associated with concentrations.
If a urine sample is taken from me and there's a high concentration of alcohol in it, doesn't that suggest that, I said high concentration, doesn't that suggest that I'm intoxicated?
It can. It depends on the officer's observations. It can help, I believe, be associated with that. But if you're going to look at urine concentrations of alcohol in science, there's a very loose correlation. There has been several studies done on it. But currently, if you're just voiding your urine or urinating into a cup and there's alcohol in that, that does not correlate to a blood concentration. It could be much higher, as much as 40% higher.
What's the it there? What could be higher?
The urine concentration could be higher than your blood alcohol concentration. It could be lower than your blood alcohol concentration.
Okay. I would think also, though, that the alcohol would degrade, maybe that's not the right word, diminish over time in the
Yes.
in the
well, depending on how it's stored, you can get oxidation, what they call, that's a chemical term that just says the alcohol transforms into something else. So you would see a decrease from that. In addition, you might see a decrease in alcohol due to just plain evaporation.
Now, Mr. Hilden, we are using urine tests, correct?
Correct.
For prosecutions?
Yes, sir.
Both for trial as well as for pleas?
Yes, sir.
And are you having problems with those prosecutions?
No, sir. I mean, what Mr. Zarwell says, I think, is well known to people who prosecute cases. I mean, blood is absolutely the best in terms of measuring alcohol. Breath is next, and then urine. Urine has some variables involved in it, but it can inform you as to the level of intoxication, and then you take into account the things that Mr. Zarwell was just talking about, that it's, a storage and the other limitations on it. But it has been accepted into evidence in the courthouse. And you've testified, haven't you, Mr. Zarwell?
Yes. I testify often, but I will not correlate in a level of impairment with a level of concentration in urine. I will testify that I don't, that's not something that's accepted in the scientific community. It's not unusual to have a per se urine law. There are other states that do that. I'm not so sure which ones. But it is a little, how would I say, it's an old way of doing things, which is less evasive. It's because it's less evasive than drawing someone's blood. But scientifically, there's very little correlation between a urine concentration and a blood concentration. It's better to have an officer's observations to be able to say that, yes, we've got alcohol present. The officer saw these signs of impairment. They smelled alcohol. They saw it in containers. These things can be correlated with urine and results in urine. And the same goes for PCP or cocaine or other drugs that an individual might be exhibiting some sort of indicator of impairment based on drugs of abuse that if an officer can recognize or is familiar with, or better yet, is a drug recognition expert, which I know the district does not have a lot of, but is, I know, wanting to move towards that. Those things can all aid in those prosecutions. But there's no doubt from a scientific standpoint that blood and breath are a better indicator of, well, the best indicator to see what kind of effect alcohol is having on the brain, because the blood is circulating the brain, and that's where the drug is having its effect, and that's where we're seeing levels of impairment. And this has been studied heavily in the community, the effect of a level of alcohol on the blood and on the brain, which is how we actually get these types of laws set. However, the urine laws were set, and I'm not so sure